Hello guys, welcome to Radiology Decoded. Today we discuss about CRDR artifact. Let's start. Artifact is any unwanted image feature not representing anatomy. CR or computer radiography uses PSP or photostimulable phosphor imaging plate. PSP का फुल फॉर्म होता है photostimulable phosphor. Photostimulable phosphor. Next, DR uses flat panel detectors. DR uses flat panel detector instead of PSP. In case of CR, we use PSP imaging plate. Ghost image is common in CR or computer radiography. Ghost artifact result from incomplete plate erasure. Ghost artifact result from incomplete plate erasure. Double exposure causes mainly in CR. Dust on light guide produces white lines. Dust on light guide produces white lines. Dust on laser optics creates repetitive artifact. Plate scratches appear as white linear defect. Cracked PSP plates produce irregular dark lines. Dirt inside CR reader create fixed artifacts. Roller contamination causes periodic streaks. Roller slippage causes transport artifact. Plate bending permanently damages phosphor. Plate bending permanently damages phosphor. Dust on detector causes pixel defect. Dead pixel artifact appears as black. Hot pixel artifact appears as white. Dead pixel cluster indicate detector failure. Pixel interpolation hides defective pixels. Calibration correct many detector defects. Flat field correction removes detector non-uniformity. Gain calibration equalizes detector response. Offset calibration removes electrical bias. Calibration should be repeated periodically. Detector lag is common in DR. Detector lag artifact is common in DR. Image lag occurs after high exposure. Detector lag produces residual anatomy. Detector lag differs from ghost artifact. In case of CR, we see ghost artifact. In case of DR, we see detector lag. Burn in occurs after repeated high dose exposure. Burn in may become permanent. Image retention is more common in amorphous silicon detector. Stitching artifact occurs in long leg imaging. For long leg or lower limb scanogram or whole spine, stitching artifacts can occur. Patient movement causes stitching mismatch. Patient movement during long bone scanning or stitching scanning causes stitching mismatch. Detector motions creates stitching error. Softer alignment reduces stitching artifact. Grid cutoff reduces image density. Off-center grids produce asymmetric cutoff. Upside down focus grid increases cutoff. Incorrect SID increases grid cutoff. Stationary grids produce grid lines. To overcome grid lines, we use moving grid. Moving grid blur grid lines. Moir's artifact or Moir artifacts occurs with stationary grid. Moir is common in CR. High frequency grid reduces Moir's artifact. Grid lines parallel to scan direction increase Moir. Aliasing is another name of Moir's effect. Sampling frequency affects aliasing. Nyquist frequency determines aliasing. Sampling below Nyquistic causes artifact. Electronic noise increases at low exposure. Quantum mottle, this is very important. Quantum mottle occurs from insufficient photons. Quantum noise increases with lower MS. To correct quantum noise, we have to increase MS. Higher DQE means detective quantum efficiency. Detector quantum efficiency. Higher DQE reduces noise. DR has higher DQE or detector quantum efficiency than CR. Lower DQE requires more radiation. Exposure creep is common in digital imaging. Exposure creep increases patient dose. Wide latitude marks overexposure. Histogram analysis determines image processing. Incorrect histogram causes processing error. Histogram failure alters brightness. Wrong collimation affect histogram. Multiple body parts confuse histogram. Prosthesis may distort histogram. Shielding inside field alters histogram. Excessive air causes histogram failure. Poor positioning creates exposure field recognition error. Exposure field recognition is automatic. Incorrect anatomy selection causes artifact. Wrong exam menu affect processing. Edge enhancement exaggerates noise. Excessive sharpening creates halo artifact. Smoothing reduces fine needles. Noise reduction may hide pathology. Incorrect LUT or lookup table affect contrast. LUT means lookup table. Exposure index estimates detector exposure. EI or exposure index is not patient dose. Deviation in exposure index requires investigation. Saturated pixel lose information. Saturation occur after excessive exposure. Blooming spreads signal into neighboring pixel. Blooming differs from local focal spot blooming. Detected saturation reduces diagnostic value. Detected dropout creates black areas. Cable damage produces intermittent artifact. Loose detector cables cause image loss. Wireless detector interference affect transmission. Battery failure interrupt DR acquisition. Detector overheating increases electronic noise. Static electricity affects CR plates. Fingerprint appears as localized artifact. Oil contamination creates density changes. Blood contamination damages imaging plates. Cleaning plates prevent artifact. Cleaning detectors improve image quality. Hair on detector mimics foreign body. Clothing fold creates pseudo lesions. ECG leads creates metallic artifact. ECG leads sometimes left on chest region creates metallic artifact. Oxygen tubing appears as linear opacity. Jewelry causes high density artifact. Buttons may stimulate calcification. Coins mimic foreign bodies. Mobile phones should be removed. Patient ID markers should never cover anatomy. Incorrect markers require repeat documentation. Lead marker create complete attenuation. Grid damage produces repetitive line. Bent grids create distorted cutoff. Grid contamination creates streaks. Detector housing cracks increase artifact. Water damage destroys flat panels. Moisture damages electronic circuits. Detector impact may cause pixel failure. Portable DR detectors are shock sensitive. Anti-scatter grids improve contrast. Scatter reduces contrast resolution. Poor collimation increases scatter. Large field size increases scatter. High kbp increases scatter. Scatter produces image fog. Backscatter creates unexpected densities. Backscatter may originate from cassette backing. Lead backing reduces backscatter. PSP plates are light sensitive after exposure. Delayed processing increases fading. Fading decreases signal. Immediate processing preserves image quality. Eraser lamps remove residual signal. Eraser lamps are provided in cassette scanner. Failed eraser causing ghosting. Next, white specks may indicate dust. Black specks may indicate dead pixel. Vertical lines suggest readout failure. Horizontal lines suggest scanning defect. Repetitive artifact indicates mechanical causes. Random artifact suggests electronic noise. Detector recalibration correct many fixed artifact. Uniform phantom detector artifact. Service engineer evaluate detector gain maps. Flat field images reveal calibration error. Phantom QC detects hidden artifact. Daily QC minimizes repeat rate. Monthly QC assesses detector stability. Detector uniformity is a QC parameter. Spatial resolution depends on pixel size. Smaller pixel improve resolution. Smaller pixel increase noise. Larger pixel improves sensitivity. CR resolution depends on laser spot size. DR resolution depends on detector matrix. Pixel binning improve SNR or signal to noise ratio. Pixel binning lowers spatial resolution. Electronic interface causing banding artifact. Power fluctuation affect detector electronics. EMI may mimic detector failure. Software updates improve artifact correction. Firmware errors may create processing artifact. Incorrect calibration flies distort image. Detector synchronization is essential. Synchronization error cause image loss. Exposure timing affect wireless DR. Premature detector's movement causes blur. Motion blur cannot be corrected by software. Respiratory motions reduces sharpness. Cardiac motion affects chest imaging. Voluntary motion causes repeat imaging. Immobilization reduces motion artifact. Pediatric imaging has higher motion risk. Positioning errors mimic pathology. Rotation alters anatomical appearance. Clipped anatomy affect histogram analysis. Excessive collimation may cause histogram failure. Poor centering affect exposure recognition. Detector tilt changes anatomy projection. Image inversion is software generated. Windowing cannot restore saturation pixel. Post-processing cannot recover missing data. Repeat exposure increases patient dose. LRI applies to digital radiography. EI monitoring reduces exposure creep. Reject analysis identifies artifact trend. Repeat analysis improves departmental quality. CR plates require regular inspection. DR detectors require calibration logs. Preventive maintenance or PM minimizes downtime. Daily detector cleaning reduces artifact. QC phantom detected subtle failures. Histogram analysis is vendor specific. Exposure indicators vary among manufacturers. Detector DQE determines dose efficiency. MTA for modulation transfer function determines spatial resolution. NPS evaluates image noise. DQE detector quantum efficiency combines MTF and noise performance. Artifact recognition prevents unnecessary repeats. Digital artifact may mimic disease. Always inspect raw images before processing. QC is essential for diagnostic confidence. Most DR artifacts are calibration related. Most CR artifacts are plate related. Recognizing artifacts is core skill for every radiographer. Please subscribe to this channel and follow for more videos.